Hello, dear students and doctors. Today, in Homeopathic Therapeutics A to Z, we will learn bedwetting and Enuresis in children. So, dear friends, if you want to learn Materia Medica and Therapeutics, you can subscribe my YouTube channel and follow me on FB, Instagram, and join my WhatsApp group of e-trainings. Bedwetting is a potentially serious medical and psychological problems affecting about 2 millions of children every year from age 6 to the adulthood. Many parents and patients who did not get help from so-called traditional medicines turn their hope to alternative medicine. In this video, we will look into remedies that homeopathic medicines offer to help those patients with bedwettings. There are about 134 homeopathic medicines listed in our reference books for incontinence of urine at night. So, to remember, all these medicines are very difficult. Here I will explain few remedies which I have used in my practice successfully. Constitutional and miasmatic medicines are the best to prescribe, but if lack of time to take proper history, these acute medicines also do wonder. First of all, we can divide all medicines under first, time of enuresis, second, cause of, third, sleep pattern of children, then character of urine and associated symptoms. So let us begin with the first medicine, very common medicine, belladonna. Now time of enuresis here generally after midnight or towards the early morning, daytime, and the cause eating too much sugar. So you should inquire when patient have enuresis and eating sugar. Then another cause is paralysis of bladder. Here the sleep pattern, half open eyes, restless during sleep with sudden start, and screaming during sleep, grindings and sleepy yet cannot sleep. Belladonna child sleeps with hands under head. Here the character of the urine is yellow, turbid, sometimes dark red and strongly acidic. And the associated symptoms, easy perspirations, feces escape while urinating, and sensation of warmth, something is crawling in the blood. Second very important remedy we use constitutionally, Calcarea Carbonica. Here, time of enuresis, when the patients in bed, when walking, or after midnight, hysterical as well as the spasms of the bladder, loss of fluids and the ailments of fright is one of the causative factors. And the nightmares, very important, fearful, and the children snores. Here dark brown, strong odor of urine with offensive smell. We use this as a polycris remedy. If constitutional and the mind matches, then we can give constitutional medicine for the same. Here the constitution fat, fabby children with the red faces and tendency to catch cold easily. Temperament, dull, confused, fearful, as well as forgetful. And the most important, easy perspirations, history of pica is there, and the pituitary and thyroid dysfunctions. Another important remedy, Causticum. Here the Enuresis time during the first half of the night. You should ask always, and during cold weather, during cold nights, or when coughing or sneezing causes involuntary urinations. The cause is fright, grief, night watching. Maybe due to weakness of bladder or atony of the splinters. Here the pattern of sleep, very restless sleep. Drowsy, can hardly awake. Parents try करेंगे awake के child को, but they will not. No sensation of passing urine. Cloudy urine and bloody urine, and the associated symptom or tendency sometimes the warts, weakness, and the confirmed stool passes in a standing position. Very important and popular remedy, Sina. Generally, enuresis occur during the second half of the sleep, full moon, and the causative factors always confirm worm infestations. So restless during sleep, lies generally on abdomen, niches position, grinding teeth, rubbing with the nostrils, and will not sleep unless rocked. Character of the urine, copious, turbid, and the child is a restless, touchy, capriciousness, always feel hungry, and there is a tendency of convulsions. Then comes more specific, we can say we use Equisetum. Day and night patients have a complaint, and the cause here, child has developed the habit of wetting the bed at night during sleep. So habitual without any known cause. Child has a nightmares in Equisetum and frightful dreams with bedwetting. The dreams of seeing crowds of people. And you can watch my YouTube video Materia Medica series A to Z. Equisetum explained very well, in especially Enuresis also. Character of the urine, light color, profuse, and there is a dyspepsia associated, and it is a remedy of choice for cystitis when general aggravation after urination is present. Next, very important remedy, creosote. Here the first part of the night bedwetting is there. We use this remedy when the child passes urine while in a deep sleep, and it is tough to waken the child. So enuresis with the dreams of urinating is one of the important symptoms. Dreams of falling, dreams of poisons, of fire. Would not sleep unless scarce. The character of the urine, high frequency of urination during the day, means copious, and the presence of red or white sediments in the urine, and the urine offensive in order. This remedy is specially useful in overgrown, poorly developed children who suffered from rapidly decay of teeth with spongy bleeding gums. So these associated symptoms always help in selection of the medicines. Another very important, I'm using Lycopodium. Frequent urination during night and involuntary urination during sleep. The child passes large quantities of clear urine at night, but the quantity is normal during day. Patient says like that. One of the most important of this remedy is the presence of red sand urine, which is found in a child's diaper. Urine if left in contact, the redness and irritate the skin of babies. Remedy is strong, antisoric and psychotic and suitable for children who crave everything warm, especially all type of food, and craving for sweets and sugar. Then comes Phosphoricum acid. This is one of the frequently used remedy in enuresis of children who is virtually flooding of the bed with urine and usually comes during the first sleep. The urine is profuse, watery and milky. Here enuresis is due to weakness of bladder and urine passes during even cough also. This remedy used after acute disease and in children who are mentally and physically debilitated. Then important remedy Sepia. The first sleep wets the bed as soon as the child goes to sleep. Maybe because of the cause is because of the anger, vexation, and the pattern of sleeps talks loud, wakes up restless, and dreams of urinating. Foul, sour, white, milky, or red, scanty urine. Sepia child is indifferent and of shallow complexions. Here they have a desire and tenesmus, sudden desire and tenesmus in the girl as if uterus would come out. Another very important remedy, sulphur. Sleeps in catnaps, talks, jerks and twitchings in the sleep. Wakes up singing and weird dreams. Passes great quantity of colorless urine. This is suitable for pale, thin children with a large bellies who hates washing and bathing, very commonly we have seen, an irresistible desire to urinate on seeing the water running and sudden desire to urinate and must hurry or urine would pass involuntarily. Here enuresis while dreaming of urinating and due to warm complaints. Then come thuja officinalis. Involuntary urination at night or when coughing frequently gets up at night to urinate. Psychotic children, especially due to ill effects of vaccination. Sudden desire to urinate and cannot wait or control. Maybe due to paralysis of splinter and the urine is highly colored with a strong odor. Frequent urination accompanying pains. So that's all, dear all my students and friends. Therapeutics of enuresis, common remedies. Thank you.